St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us right here on our live health talk show every Tuesday with me, Maureen Kimani. And today we shall be talking about halitosis. Are you the kind of a person who experiences bad breath, or a person who struggles with bad breath? Well, as I said earlier before, the technical term of this bad breath is halitosis, and we shall be having in our studio we have our guest from St. Mary's Mission Hospital, and she will be talking to us what are some of the causes of this halitosis, the preventive measures, and if it can be cured to avoid this thing that is called halitosis. Well, this program is brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital. Welcome, my name is Maureen Kimani. Very good morning to you. Let's get started. Hi, good morning.
Morning to you.
How are you doing?
Maureen? I'm doing good. And I thank God that I'm here this morning just to discuss about our mouths and mainly on how to keep our mouths clean. Because that is what we majorly do in St. Mary's. So I represent dental department, and my name is Kezia Wanjiko. Yes.
Well, good to have you, and welcome right here in Capuchin TV to our health talk show. And in case you have a question about this halitosis, you can text us on our SMS number, that is 21760, or you can use our phone number, that is 0717 424 866. And I'm sure we shall be able to answer your question to you. Well, Kezia, thank you for coming. And as we talked about these halitosis, maybe our viewer, they have ever heard of this name. Can you explain what is it?
Halitosis in Rima word, just as we know that we are every day, or everyone eats every day. Halitosis is just that it's a self-explanatory word. It is bad breath, and when we talk about the mouth, majorly, and it's the one that causes, or when we talk about oral hygiene, it is the main cause of halitosis. And halitosis can go beyond the mouth, so we might be speaking about the causes. They are systematic and orally. And because I'm a community oral health officer, we'll be speaking about the oral hygiene and how to keep your mouth.
Very true. And how common is halitosis, and what's the age bracket for these halitosis?
Halitosis is common. Sometimes it can be unconscious, sometimes it is conscious. And just from the beginning, the way I said, as long as you eat, you can be prone to halitosis. And what you should know is that we should keep our mouths clean so that to avoid halitosis.
Well, hygiene is very important, even to our last episode on Health Talk. We're talking about how to make sure our feet, the towels are very clean, and it's a good thing that it's kind of a continuation of these. And how do I, since you say that it's very common, let's say in Kenya, how do I tell that I have halitosis?
You can tell it by yourself, or even the people that are around you, because of course we use our mouths for talking, social, relationship. So somebody else can tell you, but as long as they are close to you, because it is more personal. Yeah, when it comes to types, we have the pseudo. I'm just going to briefly explain what is pseudo halitosis, where some people have halitosis, but they live in denial. So when you begin to tell them, by the way, I'm feeling something maybe not really good about your mouth, they will feel offended. So a person who can really test is yourself. You can test yourself by just maybe placing your hand near your mouth, and then you just breathe out. Then you can just feel the smell. Or even when we are speaking to you, or when I'm speaking to you, you are able to tell. because you have the senses. Your sense can tell you that breath is bad or that breath is pleasant. Yes.
So if I put my hand in my mouth and then smell it back, if I experience or if I feel I have a bad smell, does it mean I have halitosis?
Yes.
High chances?
High chances that you have halitosis. You can say I brushed my teeth and still I have halitosis. So that's now when we can have now the discussion on maybe how effectively you can do to maintain your good oral hygiene and having fresh breath.
Okay, thank you so much, Kezia. And taking you back, you talked about it's very common because as long as you're eating, you're very exposed to having these halitosis. That is if you don't take care of yourself. And what's the age bracket of these halitosis? Do babies get halitosis? And
Yes.
why? What are some of the causes?
Yeah, I said from the beginning, as long as you're feeding, breastfeeding is a form of feeding. And so because they are feeding, we can have the food debris, the milk debris remaining on the gum of the toddlers. And if the parent doesn't take the initiative to clean the baby, the bacterial reaction when the milk debris are left, they form a sulfur compound. That sulfur compound is the one that brings the bad odor. So even children are prone. So the age group or the age that is prone, we can say, is when a child begins to breastfeed, because that's when they begin to feed. From when they begin to breastfeed to the old age, because halitosis continues with, or it increases with age.
Okay, now we have the babies and young children and also the elderly. They're very exposed to these halitosis. Well, we'll come to talk about the elderly people because we know they have some of the challenges when it comes to brushing their teeth, because some of them, they don't have their teeth. And as we continue, what are some of the causes of halitosis?
One of the major causes is poor oral hygiene techniques of brushing. Maybe as the time goes by, we shall demonstrate.
Yeah, I can
the
see you carried some of
some of the tools that we use
sure.
maybe in the clinic. The effective ways of brushing. Number two, another cause is dry mouth. And what causes dry mouth? Dry mouth is caused especially when you breathe through your mouth. You should breathe through your nose. Sometimes you can breathe through the mouth, especially toddlers. Sometimes you can do it unconsciously, you just want to use your mouth. That can cause halitosis because it dries up the saliva in the mouth. That's why saliva is very much important in the mouth, so that you can keep your mouth hydrated. So when your mouth is dry, you're prone to halitosis. Number three, when you have dental caries. Dental caries is rampant, especially in Kenya. And in Rema word, we call it hole. I have a hole, every patient representing, maybe in the clinic, they say, I have a painful tooth, I have a hole. So after the diagnosis, we'll find that it is a dental caries. So if you don't treat the cavity, it's likely to bring the bad odor. Yeah, it can bring bad smell. Yeah, so you should consider also other treatments when you come to the mouth.
Okay, and sorry for that. How does stomach bacteria cause halitosis?
Stomach bacteria, it's when the reflux, when you eat and the food tends to go back to the esophagus. You see, it had already gotten the process of digestion. So that reflux back to the mouth, that acidity coming back to the mouth, combining with your saliva, it causes bad smell or halitosis. Yes. So when you come to the clinic and you maybe realize that you have halitosis, one of the best things to treat halitosis is to find the cause. What is the cause? Is it poor oral hygiene? Is it the GIT infection? Is it that you breathe through the mouth? Then if you're able to know the cause, then you are able to prevent, because halitosis is preventable. Although the way we said from the beginning, many people maybe live in denial. Some accept and they come and they are bold and say, by the way, I have a bad breath. And from there, when we get the cause, then we are able to treat from the cause. Yes. So if it is poor oral hygiene, we are able to teach you on how to brush properly, effectively. Because one of the responses that patients say, I brush every day. I even brush twice. But you can brush, but how do you brush it? How do you brush your mouth? Yeah, and when we talk about the mouth, it entails the teeth, it entails the tongue, it entails the gum, it entails the cheeks, it entails the palate. That is, we have the hard palate and the soft palate. So you can brush your teeth and leave your tongue. You can brush your tongue and leave your teeth. So you must be in a position to do it effectively so that you can really avoid halitosis.
Well, talking about the tongue, we'll talk about it later on as we continue with the topic. And as we continue with the stomach bacteria, there's some people who say that they're belching egg smell. Does that mean that can be something that can make you to have these halitosis?
Yes, we have types of halitosis. The egg smell, we have the fishy smell, we have the fecal smell. Sometimes you can have the sweet smelling aroma, but of course it is not right, because this mostly affects the diabetic patients. When it comes to, you said about the fecal?
Yeah, the egg smell.
The egg smell. Yeah, it is possible. Because you see the process of digestion and the acid production, having the reflux, back to the mouth, all that process, breaking down of the food to the sulfur compound, that process just can lead to bad odor in the mouth, because it will go back to the mouth through the esophagus. Yes.
Okay, as you talk about the egg smell, so it means if a person experiences such they're supposed to visit the dental clinic?
Yeah, you can come to the clinic, but I said first we must get the cause of halitosis. If it is far beyond the mouth, then we can refer you to maybe a specialist.
And how long is one supposed to go to visit the clinic once you find out that you have these signs and symptoms, of which we are going to be talking about in the next? I don't know if we deal about with the signs and symptoms of halitosis, and then you can tell us when can a person go to visit the clinic?
You can come to the clinic every time. Maybe you may want to come to the dental department. We always have our clinic open. You can come whether you have halitosis or not, because it is one of the prevention. You should regularly see a dentist, because of course that word or that statement that you always say, that prevention is better than cure. Yeah, you should always visit us. And when you have noticed that maybe you have that symptom, halitosis, then now we begin from there. What is the cause and now the treatment. Yes.
And what are some of the symptoms of halitosis?
Really, halitosis, one of the major symptom is, what do you show? It's bad breath. Yes, bad breath. And then we get to know the cause. Yes.
And after realizing that one has these halitosis, how is it diagnosed?
We can diagnose through our forceps. we can have what we call we can have probes whereby we test on your gum. We see the level of the socket or the level, you see the millimeter of your gum holding the teeth. If there are spaces, then we are able to tell that these spaces are the ones that have put the food debris, and when the food debris get into the gum, and the acid is produced, you see that we are able to tell you that maybe you're supposed to have scaling, just to make sure that the gum is washed properly. And another test, of course, even as a clinician, I can be able to, or as a dentist, I can tell you whether you have a bad breath or you have a pleasant breath, because when you come to the hospital, we ought to be open, but of course confidential. When I tell you, I don't have to tell you you don't brush, but now we should begin from there. How do you do it? If you need some help, I can help you on how to brush your teeth.
That is very important to our viewer. Like, you have to take care of your mouth, and not even your mouth, the whole body, because hygienically, you clean from head to toe. You don't have to clean one part and then you leave the other. And I feel mouth is very sensitive part, because when you're talking to someone, if you have bad smell, they don't even pay attention to you, because they'll be tending to look the other side and not focusing to whatever you're saying, because they want to avoid that bad smell that is coming from you, and which it's not a good show.
It is not.
So I think it's very nice for everyone to take care of their mouth. Clean it. You have heard from Kezia, you have to clean it after every meal, and if needs to be, make sure you carry a portable closet. I mean a portable toothbrush, a small one that you can be using when you are at work, when you take your meal, and you can make sure that you're very clean. And let's continue and talk about, before we go for the break, what are some, can these halitosis be cured?
Yeah, it can be cured according to the cause. If it is because of poor oral hygiene, I said it is preventable. Because many people knows that maybe brushing, you just do it because you're going to work. So you just do it very fast. And actually you'll use even less than 1 minute. But professionally, you should take time to brush your teeth by making sure that you get to all the surfaces of your mouth. And mind you, we have almost like 4 surfaces of the mouth. If I ask you maybe how many surfaces do you know in the mouth, you'll just say, you know, horizontally we just brush. What about the inside part of the teeth? What about the tongue? And what about the mucous membrane on the cheek inside, on the palate? So you must be in a position to be aware about the surfaces of the mouth, so that when you come even in the clinic, you explain, I brush every day. You even demonstrate, I brush every day. But do you have that in mind, that we have maybe some spaces or surfaces you may not be aware of? And especially people really neglect the back side of them teeth, because maybe you're not able to reach with the brush, and that's why we always advise that maybe you should have a zigzag kind of a brush, so that you can reach to the far end of the mouth.
I feel it's not because they cannot reach to the far end. It's because people don't take brushing of their teeth very serious. They tend to put it as the last thing they're doing before they leave the house, and then I'm in a hurry, just you know, like just some few seconds, and then you just walk out. You don't even go to check out to the mirror if even your tongue is very clean. Well, and before we continue, there's some of the people who even clean their lips when they're brushing their teeth. Is it right?
Yeah, you can wipe, just wipe, but of course it is not brushing your lip, because even the type and the way you should brush, you should brush having in mind that yes, the teeth is the strongest structure in the mouth, but we also have the gum and we have the lip. These are soft tissues. One of the way to make your lip healthy is just like moisturizing it. You can have some
A lip
oil,
gloss.
a lip gloss. I know ladies, we are good at that.
Very.
About men, you can be having some oil and just apply, because even during clinic time when the procedure is going on, you see a lip is so cracked, and you see when a cracked lip, you expose it to maybe to the air, you can have an infection in the lip. So we should also consider lips. It is not, don't be just, I don't care how it looks like. It's good to know that your lips should be healthy, because our main aim is to make our mouths healthy. And how do you make our mouths healthy? How do I keep my lip? I can be moisturizing it by just maybe starting by wiping it, because food is passing through the lip. Yeah, it should look also soft. It should not be hard. Yeah, have you seen people with maybe hard lips?
They are.
So when you begin to open your mouth, it can crack, and when you begin to bleed, it can be a breeding ground for infection when the bacteria just get in, because you are exposing yourself to the airborne diseases.
Well, that's very interesting. And I think we're going to take a very short break. And when we come back, I feel it's very right if we can talk about how long one is supposed to keep a toothbrush. Because I know some of the people, they even have a 1-year-old toothbrush in their house. And let's take a very short break. We will be right back with this topic of halitosis. And in case you have any question, you can keep them coming, and we will tackle them after this first part of the interview. Let's take a very short break. See you in a few.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have a dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
Welcome back, dear viewer, to our health talk show with me, Maureen Kimani, and in the studio we have our guest, who is Kezia John, the Community Oral Health Officer from St. Mary's Mission Hospital in Langata, and we are continuing with this discussion about halitosis. Well, we have been able to see some of the causes of halitosis, knowing that it's very important for one to keep their mouth very clean. Make sure you brush it correctly, of which we're going to have some of the demonstration of how we're supposed to be doing this. And let's continue with this topic of bad health. Bad breath, right? Bad breath or halitosis. Welcome back, Kezia.
Thank you.
Before we had gone for the break, we were talking about keeping our toothbrushes for even 1 year. Yes. How is one supposed to exchange or do away with a toothbrush? After how long?
All right. Professionally, the required time should be at least 2 to 3 months, because a brush, the bristles get weary, and when they begin to fall off, they are not really effective. Mm-hmm. So at least you should change 2 to 3 months. Don't go far, like 1 year, 2 years, because you forgot. because of maybe negligence. You just say it's okay. Yeah, so one thing that you should have in mind, just the way you don't wear one cloth every day, you just have to maybe change. Like the way you were told last time, you should also change your shoes. Oral hygiene also requires the same. That your brush, at least consider to change. And they are not costly, they are very affordable.
Yeah.
Yeah, maybe the costly one can be 200. The best, the better. And about the electric toothbrushes, of course we encourage that because we get, those brushes get into where the standard toothbrush cannot reach. And also you should put in consideration when you're using an electric toothbrush, don't do it aggressively because you can also damage your gum. Saying that you're taking care of your teeth, you can also be damaging your gum or even damaging your tongue. So you should be careful, and the type of the brush that you should use. We encourage the zigzag form. Let me just use an example. I have a straight one here. So maybe the required one or the one that we encourage should be zigzag form, so that when you're holding in the mouth, it is able to get to the deeper part of the gum. Yeah.
And talking about the toothbrush and brushing our teeth, are we supposed to be using cold or warm water when brushing?
I prefer, or it is preferred to be warm. Yeah, because when something is warm, and actually sometimes hot, not really damaging your gum, because the bacteria will not be able to stand the warm or the hot water. That is the main reason. You can kill a bacteria, because sometimes when it breathes into cold water, of course you are rinsing, but it is always advisable to use warm for effective. Here we are talking about effective. I know people brush their teeth. I know everyone brushed their teeth as they are going to work because of social life.
True.
Yeah, to avoid that morning breath, because of course sometimes it is automatic. Yeah, because at night your mouth is closed, you're not talking too much, and it's a breeding ground for the bacteria to eat the food debris. And in that process, that bad odor is produced. So that's why in the morning we have that bad breath. You know, people were asking, why do I wake up in the morning and I brushed yesterday? Or when I was going to bed and I still have that bad breath. It is because when your mouth is closed, the air is not circulating, the saliva is not moving. One of the importance of the saliva is that it washes away the food debris that were left. That's why we always say saliva is important. Now somebody can say, I don't need saliva. You need it because it has the content that helps us to clear away the infections and the problems that can be brought into our mouths. Yes.
Okay, well, that's very interesting. Let's talk about some of the preventive measures for these halitosis.
Prevention, make sure that maybe the diet that you're taking, all of us know that we should have proper balanced diet, but when it comes to dental or when it comes to the mouth, consider also the hard, let me say the hard foods, like you can chew an apple, you can chew a carrot. These help also to make your teeth strong, because the main aim also is to make your teeth strong. You don't want to have clean teeth but very weak. Also consider that in your diet. Should have calcium, rich food, milk, yogurt, all that. You can find out maybe the type of food to make your teeth strong.
Yeah. Like sugar cane.
Yeah,
There's sugar cane. What about sugar cane?
Yes, you can chew sugar cane. It helps your teeth to be strong. Yes, also consider a diet that is having low sugar. Don't have so much intake of sugars. Some people love sweets, some people love chocolates, some people love cakes. Sugary diet, limit. And if you have to eat, you make sure you brush, and you brush effectively. Because maybe some people cannot do away with the sugary foods, but it is always advisable that after you have enjoyed your cake, after you've enjoyed your chocolate, it's good to make sure that your mouth is left clean. Yeah, so that is a consideration about your diet. Let me talk about flossing. Flossing is a kind of a dental thread that we have, or you can even find it over the counter in the supermarkets. Is there the flossing? If you go and ask for a flossing, it's a thread that is used to make sure that interdental, in between the teeth, because when you're brushing, the brush may not be able to get inside the teeth, but the thread is able to stretch in between the teeth, and it's always advisable to floss. Yeah, so the other prevention measure that you can do is, if you're wearing dentures, if you're a denture wearer, make sure that you clean. We give instructions when maybe you have replaced with the dentures. Dentures are the fake teeth. The fake teeth. They are not really fake because now they replace the natural tooth. That's why it is always good to take care of your natural tooth. Of course, the natural tooth can never be compared with any replacement.
Sure.
We have many types of replacement. We have crowns, we have implants, and according maybe to your capability, you are able to replace according to the way you are able to pay or have in your mouth. So that is denture wearers. Another thing that you should consider when it comes to prevention of halitosis is drinking water. Hydrate your body. Water is very important, not only in the mouth, but in other systematic, in other systems. When you hydrate, you are able to increase the production of saliva. And remember, we said the saliva is important in the mouth. Yeah. So those are remedies that we can do. So halitosis is preventable. Drinking water, I don't have to tell you that you're thirsty, or I don't have to tell you every morning that you should. Now, this is about negligence and having awareness that if I don't drink water, I might have dry mouth that can cause halitosis. Yeah.
And also it can make the tongue to crack.
Yes.
Okay.
And when it cracks, it's a breeding ground, because when you're eating and food debris get to the cleavages of the tongue, then it's a good breeding ground for the bacteria. Remember, the saliva, by the way, one of the contents of the saliva is a bacteria. All of us have that natural, normal bacteria that helps us to clear away the infections. But now, when the food debris, when you don't clear away the food debris after eating, that's when we have the food debris plus this bacteria, they form the acid, the sulfur compound. And that acid is the one that goes and make holes, the holes in the teeth. And that's why somebody will come and say, I brush my teeth and yet I have a hole. So you should consider also all those combination of prevention. Flossing, you can brush, but you left the food debris inside or in the interdental spaces of the teeth. Yes. So avoid acid production that can cause the holes or the caries in the teeth.
That is very explainable, and I'm sure everyone has been able to understand, even myself, concerning these of preventive measures of taking care of our teeth, just to not being exposed to getting halitosis. And can tonsils be a major contributor to getting halitosis?
Yeah. It's a systematic cause of halitosis. One of the tests that maybe we do is to maybe examine if they are swollen. If they are swollen, we know because of the inflammation of the mucous membrane, that production of or that retention of the food debris as it passes through the esophagus, if the tonsil is able to retain the food debris, that process causes bad odor. So tonsillitis is one of the major causes. That's why we said you must know first the cause of halitosis, because it must have a cause. If it is halitosis, get to the specialist or to the doctor who is supposed to check and maybe give you some antibiotics. And one of the main thing also to do, because tonsillitis is also caused by sugary diet, especially children. Yeah, avoid these sugar intake foods to the children. Unataka kufurahisha mtoto. Yeah, unaweza mpe kitu healthy. It is not bad to give them maybe a fruit. To spoil them. Yeah, give them a carrot. You know, it will make them even enjoy.
And apple.
Yeah, having that cracking sound. But when you give them sweets, watakuwa ni mazoeo. Kwa sababu, when it comes to oral hygiene, it's a journey. And especially when you teach your children on how to do it very well. Especially even as a parent, when they are young, when they are breastfeeding, you begin to wipe them, teach them on how to brush, make them enjoy it. Yeah, make them have like fun. You know, Colgate. You know, the toothbrush. Show them the bristles, and they are able to enjoy. And that journey will not maybe come out of their conscious, because one of the things of the challenges that comes with the elderly is that they are getting awareness when it is maybe too late. You're coming to the clinic because you have pain, you know, cavities are all over in your teeth. So prevention, this statement, prevention is better than cure. In dental, it really applies.
Actually, I think it applies everywhere.
Yes.
Because as you talked about taking lots of water, even to our last episode, we were talking about constipation. Water helps a lot to prevent someone from being constipated. The same case, water helps in our mouth, just not to have that dry mouth for us. And just reading some few feedback that I've just received right now. We have Miriam Juguna watching, Ishmael Mwano. We have another person who said, wow, this is great. Congratulations, St. Mary's Mission Hospital, with love emoji. And then we have Ricky Johnny following from Kitui. We have, that is Ricky Johnny. Thank you for your feedback. Thank you for following this discussion of halitosis and how we are supposed to make sure that our mouths are very clean at all points, each day, every time. And I think it's a very nice thing we proceed. You can maybe show our viewer how are we supposed to brush our teeth. I think you can have a demonstration.
Yes, I can have my human mouth.
Yeah, we have, okay.
This is just an example of human mouth, where we said that the mouth entails the teeth. You can see them here. Then when you open up your mouth, because when you're brushing, you must open your mouth. Don't just brush the outer surface. When you open your mouth, there is a tongue, because this is just a model. There is a tongue. And now we have the palate, the upper and the lower, the hard palate and the soft palate. So when you're brushing, you should consider that the mouth is not just made of the teeth. It is made up of your gum also. You should consider a healthy gum. Your gum should not be swollen. Your gum should not be reddish, so reddish in color. Your gum should be healthy, and the healthy gum, mostly it is pink in color, light pink in color. Now, when it comes to unhealthy gum, it's when it is swollen, it is when bleeding. When you just touch it like that, it will begin to bleed. So how do I effectively brush my teeth? If I asked you, did you brush your teeth today? Yes, I brushed. So how did you brush? Now you have your toothpaste, you've put your toothpaste, and of course having a lot of toothpaste Does it mean that that's when the teeth are going to be clean? And actually it should be a piece, you know, the piece size. Not really a lot, not really little, but medium piece amount, yeah? Because of the amount of the fluoride. And of course, when it comes to toothpaste, fluoridated toothpaste is always the best. It is always indicated. The ADA association always have a seal for all the approved toothpaste. You know, there are people that ask which is the best toothpaste to use. Now, according to your choice, we have so many, especially in Kenya, we have close-ups, mention them. But as long as it is approved by ADA, the association that have the seal, fluoridated levels that you can consume in your mouth. So it is always good to check. Now let's go to the cleaning. You just make sure that your brush is on 45 degrees. 45 degrees. Not really like this, but 45. Whereby you are able to get to the, you start at the anterior. Meno za mbele. Anterior, we call them anterior teeth. So when you hold your brush at 45 degrees near to the gum line, by making sure not just here up. That's the method that we know. But professionally or maybe effectively at 45 degrees, you make sure that maybe you get to the gum line. You start from the anterior, meno ya mbele. And then you can just have a motion, a round motion, because you have many techniques. You can have horizontal, whereby you just chip off the remaining debris. But the round motion is always advisable because you get to the gum. And you see, it is not very aggressive, because when you are aggressive, you can also peel off the enamel. The enamel is the outer part of the tongue, of the teeth. When you peel off, you can have some bleeding, sensitivity of the teeth, or bleeding to the gum because you're damaging it. So you start from here, you go round, both lower and upper. That will take almost a minute. So in 1 minute, some people have finished all the surfaces. So how many minutes should you take? Maybe approximately, when we can say that you have completely touched all the surfaces, 2 to 3 minutes, to be real. Even if you're late at work. You know, when I tell you 4 to 5 minutes, you'll be like, that one cannot be real, because maybe in the morning I'm in a hurry. So it is good to consider to be in reality. 2 to 3 minutes, that's not too much. It's effective to your teeth by making sure that all the surfaces are clean. So when you finish, you get to the posterior, hizi meno za nyuma, all the surfaces. That will take almost a minute. So after you finish, you open your mouth. You see, you have to open your mouth systematically. Because, you know, just don't brush and then you just open, close, open, close, because that's what we do. You just want to do it very fast. So systematically, just close, relax, open. You make sure that the outer surface is clean. When you open, there is this part of the inside of the tongue, of the teeth. You start from the anterior, you get to the posterior with the same round motion. After you're through with the lower, you get to the upper. No, you start from here. You get to the posterior with the same 45 degrees, the round motion. It will be effective. That is another minute, the inside of the teeth. Then remember, we have the tongue. Now, when it comes to the tongue, before we get to the tongues, we have the upper part where we are used to bite. You know, you may consider, I brushed it as I was brushing horizontally. It's good to consider, after you're finished with the inner part, there is this surface whereby we use it to chew, because we have cleavages and we have bends that can store the food debris. So it is always good to consider at the upper surface of the teeth. Then we get to the tongue. If you don't have tongue scraper. That is when you scrapping, just not aggressively, pole pole tu. Najua kuna watu wanasikianga kutapika.
Yeah.
But try your best to make sure that from behind you just brush your tongue as you scrap forward to make sure that all the food debris are removed from the tongue. And if you don't have a tongue scraper, you can use the behind of your toothbrush. The behind, you can just scrap it, scrap the tongue. The main idea is to remove the debris or the food particles that were not removed maybe after you gargled with cold water. And after that, you just rinse with clean water. You asked about whether it is good to use the warm or the cold. You can have your warm water. You rinse your mouth. And then now you can touch the hard palate by making sure that even the cheek on the sides you have clearly cleaned the food debris. Then you rinse your mouth. That will take 2 to 3 minutes. So when you do it every day, halitosis can not be a symptom for you. And also, you can be able to prevent dental caries, because one of the rampant things that people come to the dental hospital or the dental department is because they have holes. But when you do it very well, effectively, you are able to prevent even infections and many diseases. Yes.
Well, wow, that's quite an interesting way of showing us how we're supposed to brush our teeth. And I think that's what we're going to wind up, because our time is up. But before we do that, maybe you can say, when is the clinic open at St. Mary's Mission Hospital?
Yeah, we are always open from Monday, the working days, from 8 a.m. to 5 p.m. every day. And even we work on Saturdays, half day, maybe by 1 p.m. Yeah, so you're welcome. You'll come meet us. You can consult. Thank God St. Mary's is affordable. You can only have 100 shillings to come and ask about your dental hygiene. You can be taught on how to brush your teeth. You can ask about your children, your kids, the diets that you're supposed to take. Yeah, but just consulting with 100 bob, just 100 bob.
Wow.
So you're very much welcome.
Thank you so much. Thank you so much, Dr. Kezia John, for making time to come and share to our viewer what you're supposed to do for our hygienic way, that is mouth, and to prevent ourselves from these halitosis. And I'm sure that we have been able to learn, because most of us, let me say so, we have not been doing whatever Kezia has just demonstrated, but now you have a clear picture of what you are supposed to be doing, that is from lunchtime onwards. Thank you so much to our viewer for following this health talk, and for those ones who have sent their feedback to us. Thank you so much for following and for learning. Make sure you share whatever you have learned to your relatives, your friends, and everyone around you, and to your family. Thank you to the people that has been behind the team, that is Capuchin TV crew. We have Christopher Odhiambo, Michael Ndegwa, and lastly, we have Frederick Ochieng and Michael Kibandi. Thank you so much, and may God bless you. Have a good day. See you next time.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa hivi mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.